School nursing is really a commitment that community has made in terms of living our mission. Our kids are increasingly sick, have chronic conditions, and the nurse in the school not only really optimizes health for the students, but keeps the kids safe. We have nurses in 8 different township schools, and the nurses are there every single day school's in session. We've got kids that are on oxygen. We have kids with chronic conditions like diabetes and asthma. We have kids in school that have cancer and are undergoing treatment. There was just a study published that talked about the 10 worst states for children's health. We were actually 4th. There are only 3 states worse in the country. That's not a good place to be. If there's a student with a new condition, the nurses will work to make sure that the parent's educated and knows how to manage that child. When I first started working with the schools, one of the things that we identified was that students were being sent to the school nurse office too late often for the nurse to be able to intervene and be able to send the child back to school. A child came to the nurse's office frequently, and over the next several weeks, the nurse noticed physical changes. It concerned her that something more was going on with the child, and she contacted the parent and encouraged the parent to go and get a definitive diagnosis from a physician, and it turned out to be cancer. But it was the nurse's observation of the changes that she was seeing in the child that prompted that early identification. Every year we have ongoing education for the nurses, and then as a system, we also offer reimbursement for the nurse to go and get certified in pediatric, which is a level of expertise that's recognized in caring for children. This year, we're bringing in a review course to prepare the nurses to sit for the exam so that we do make sure that they're particularly trained in caring for the students. There's 3 areas that we looked for donors for. The first is to meet the basic needs of kids. It might be a new set of clothes. We have kids that show up in the same dirty set of clothes day after day after day. Kids truly are the future of our country, and I think it's important that we set them up for success. First is meeting the basic needs for the student. We actually worked with a foundation this year, and were able to give every school nurse a gift card that they could use to address an immediate need for a student. We had a student that we bought eyeglasses for at one of the schools, and the mom cried. She knew her daughter needed glasses. She didn't have insurance. She couldn't afford it. Kids in the seat, kids learning, kids having a sense of safety at school, all of those kinds of things are what we're looking to achieve. We want to make sure the student's healthy and well so they can learn, and so we measure our return to classroom rate. And we're currently at 97 to 98% of the time that we return the child to the classroom.
Community Health Network. Exceptional care, simply delivered.